Hello, hello, hello. My name is Tamara Green, pelvic rehab therapist, and I help women overcome those uncontrollable bladders, return to pleasurable sex, and conquer those pregnancy symptoms to become postpartum champions. Welcome to Below the Skirt with Tamara. It's me here, and here's my guest, as I always do, Virginia. So, as you can see with the flyer that was put out, that on the road from painful sex to pleasurable sex. So thank y'all for tuning in. So what the question is, how can why is sex painful? Is it normal to have painful sex? So to answer that question, the first answer is no. Painful sex is not normal. Painful sex is not healthy. Sex should be pleasurable. Now, as I talk, just so you can understand the dynamics of what's engaged, we're in the vulva area and you have the vaginal canal. So question would be, would you ask yourself, are you having painful sex? Do you notice pain when it's during insertion? Are you noticing pain through the process deep inside while you're having intercourse? Now, there's many reasons as to why this could be. It could be because there is a narrowing of that vaginal canal. So the canal of the insertion of a penis or whatever, if you're utilizing a device, if insertion is uncomfortable, if insertion, not just with sex, say you're at your OBGYN's office and they're doing an internal examination, just getting set up, when they are checking you out, it's very, very painful. Say it's painful also too when you're trying to insert a tampon. Any form of any type insertion, right? That would be in return painful if you were having sex. So there could be a component of the canal being too narrow, right? It could be a component of the pelvic floor muscles. As we've talked about before, these pelvic floor muscles, they sit like a hammock inside of the pelvis. They could be too tight. So with insertion, it's very, very uncomfortable. So you should not be having sex. Now, if you're in a situation where whatever is being inserted is too long or for what your canal is able to hold, then yes, you may have discomfort. But if you're having discomfort just with insertion, it should not be the case. Now, things that you can do. Now, when you're having painful intercourse, you should not be doing any form of strengthening of that area. Pelvic floor strengthening. If there's a hypertonic muscle, if the muscle is really, really, really tight, you don't want to work on strengthening a tight muscle. For example, if I have my biceps here, right? If I have a tight muscle, we don't strengthen from this range. We go through the full range and then we pull all the way through. That is the same thing that goes on within the pelvic floor. You don't want to do any type of strengthening, Kegel exercises, for example, of the pelvic floor if you're having a tight pelvic floor. So something that we do with pelvic physical therapy, we work a lot on down training, teaching you how to relax that pelvic floor muscle. If it's for it could be just working, again, relaxing the pelvic floor, teaching you how to use your muscles to activate, to relax them. We teach you different mechanisms of behavioral, anything that will allow you to relax that pelvic floor, especially during stressful times. That is very common where the pelvic floor could be overactive, right? And it could be uncomfortable. Now, so that's a scenario, overactive muscles. You could be dealing with other diagnoses where there's inflammation. It could be from endometriosis of the scar tissue, the endo tissue that is gravitating in different areas, causing you pain. And then as it's causing pain, it then in return affects the pelvic floor. Now, think about it. If you hurt your back, right? Your original problem is the back, but what happens? The body responds in a different way. So then you start getting muscle spasms. It's something very similar to that of the pelvic floor. So if you have an injury, or you say you broke your pelvic bone in the previous point of time, say you fall and you landed on your coccyx, your tailbone, right? This area too, over time, if it's not adjusted the right way or the muscles really tense up, painful sex can be painful. And it's very common with women who'll say, hey, I'm not able to engage into sex because I'm not able to lying on my back for long periods of time, or I can't position my legs at a certain way with intercourse because it's too painful. I'm only able to get in certain positions that I can control that will allow me not to have pain with sex. So again, if you're having sex and it's painful, that should not be the case. And you may say, well, how does pelvic therapy help with that? Well, first of all, we have to figure out why. Why are you having the painful sex? So you may come to the office because you were a self-referral, or you may come because you have seen some type of you're a medical provider. The biggest thing is making sure you're ruling out there's nothing that is going on medically that could be causing the pain. Could there be an STD involved? Could there be something else that is causing pain? Now, once medically everything is okay, there's no infection, things are ruled out, then we start peeling back the onion as to why could you be having pain. And it doesn't necessarily, and you don't necessarily have to have pain with something being inserted. It could be pain because of inflammation over the in the vulva area, right? So there's some different diagnoses that you could have that could cause that. So is there inflammation around here that's causing pain that makes you not want to have sex? And if you think about it, sex is a natural component of life, right? It's a natural component of life. And with it being a natural component of life, if you are in a relationship, if you're not in a relationship, you're not wanting to go in a relationship because you're afraid that sex is going to be painful, it's a very isolating sensation or isolating feeling. And some people, and I've noticed, they'll come into the office and they're like, hey, I'm just not going to be in a relationship right now because it is truly painful. I don't want to be in a relationship because I don't feel like I can bring all of the woman that I want to bring because sex is painful. Some come in, and I've noticed as well, if someone has been through, say you've been through a situation where you have had some type of sexual trauma, sexual abuse of some sort, getting back to sex, if that's what your desires are, it's painful. And that's definitely a part of it, not just through the pelvic physical therapy, because it's a mind component. It's a mindset that we're dealing with, because it's like, okay, are you receptive? And a lot of times our body will block what we may think we want because we're not ready. And that's where we definitely may have to inquire as a referral to a sex therapist. Again, we're clear medically to make sure you're okay. There's nothing going on from a medical provider as your primary care physician or your OBGYN. The next step is, okay, everything's fine. There may be a mental counselor that may need to be brought in. There may be a sex therapist needs to be brought in. So again, there is so many components of this that we are looking at, because it's the whole woman. It's all of you. We're encompassing all of you, mind, body, and physicality, right? So again, there's many different reasons as to why someone can have painful sex. It could be because the pelvic floor muscles are really, really tight. It could be because you're dealing with some deficits because of other diagnoses like endometriosis. It could be for the simple fact that, hey, you had a perineal tear. You had a tear from here in this region. It could have been all the way from the vaginal opening all the way to the anal canal, or it could have been a slight tear. You could have had a episiotomy, during childbirth. Again, as things are healing back up, as scar tissue is coming, it's trying to be stretched. So definitely trying to be stretched. So in those situations, things that we work on in pelvic therapy, working on opening the canal, working on stretching it, because if you're having pain with insertion, it's like a rubber band. If something's been tight, you have to gradually try to open it. And we start with women who've been able to only insert a size of like a tampon, and then we progress to the size of what an actual penis would be. In working on increasing that range on your own, in return, will allow you to be able to engage in non-painful sex if yours has been with a narrowing of the canal. Say you're dealing with a prolapse. It could be painful, right? Because a prolapse is any form of descending of the organs that sit within the pelvic floor. That could be the bladder, it could be the uterus, it could be the rectum. So with the descending of that, when you are inserting anything into the pelvic, into the canal, something may be blocking. So it may be uncomfortable from that. So we then again, coordinating with your gynecologist in that arena, there are other things that we can work on that will allow you not to have painful sex in those components. So just giving you just different reasons as to why someone could have painful sex. And again, there's different diagnoses too that would allow you to have painful sex. Now, what do we do in pelvic therapy? Well, pelvic therapy, we work on increasing the vaginal canal. We work on relaxing those pelvic floor muscles to be receptive and allowing you to receive, not having pain, right? We work on also too, once the pelvic floor is definitely nice and loosened and all of that great stuff, then we work on strengthening, right? We work on strengthening to allow a stronger pelvic floor, to increase that foundation of that pelvis, to allow a better stability of the body. So those are things that we work on within that. So you may say, okay, now that what do I do? How do I know if I need pelvic floor physical therapy? Well, if you are having pain with intercourse, if you just feel like I try at the beginning of sex, it's okay, but then it just becomes painful, right? Again, sex should not be painful at all. It shouldn't be painful at all. Sex should be enjoyable. It should be pleasurable. You should be able to have an orgasm during that component. So some of those muscles may not be doing what they need to be doing. So those are the different things that we encounter. Now, I know I spoke a couple weeks ago when it talked about like postpartum, right? So postpartum, if you have come from your appointment, you're cleared by your OB to be able to engage into sexual activities. Just that mentality of like, I'm afraid. I had so much trauma go on during my pregnancy, during the process, that I'm afraid to have sex. Getting to that point may definitely, again, if you've recently have been pregnant, engaging in pelvic floor physical therapy is really great, because some women, and you may be having that feeling like, I'm just not sure, I'm just not ready. Well, we can work on things to prepare your body so that you're able to engage in the sex. Or it's been a very long time. We're able to prepare your body so you will be ready when you are ready for that. And I know it is definitely challenging if you're in a relationship, if you are married. I've had women, they come in and their marriages are really, really challenged because they are not engaged in any sexual activity. Now, is sex everything to a relationship? No, we know that it's not. Is it a big component of it? Yes, it is. And I'm just saying, don't let your marriage be challenged. And this is a judge-free zone. My job is to allow you to live your best life below the skirt. My job is to make sure you have the quality of life that you so desire when you so desire it. Now, if your marriage or if your relationship, or if you don't want to go in a relationship because you're feeling isolated, because you just feel like you can't bring all the woman that you desire to the table for that, you need to start pelvic floor physical therapy. That's something you need to do. And you don't have to live in silence about what you're feeling or what you're going through. I want you to know 1 in 7 women have some form of pelvic, excuse me, One in seven women have a form of pelvic pain. So when I say pelvic pain, we're talking about a big range here. We're talking about a range from this hip bone to this hip bone, and then all the way down to the vaginal canal. All of this is dealing with your pelvis. That's including painful sex. That's including a surgical incision. That's including that includes a whole lot of area. So I just want you to know 1 in 7 women have this issue. You are not alone. You don't have to live in silence. You don't have to feel like you're below the skirt issues or things you're having problem with is going to allow, you don't want your below the skirt issues to block your above the skirt matters. So when I say that, meaning I can't I don't want to become in a relationship because I'm not able to engage into any sexual activity. Okay, that in return comes above the skirt, right? That's above the skirt matters. That means I don't want to become in a relationship. I'm just going to stay where I am because I'm afraid or I'm embarrassed. It doesn't have to be that way. You can truly live your best life below the skirt. You just need some guidance. You understand what I'm saying? You just need guidance to get there. And to be able to get there, you have to have a pelvic therapist on your team. So yes, you have the medical component. Yes, you have the doctors, but you need a pelvic therapist on your team to be able to see what is going on with the pelvis functionally, physically. Do you have the flexibility? Is your abdominal region, right? This plays a lot with the pelvis. Is your abdominal restrictions causing below the skirt matter? So we as pelvic therapists like myself, we look at the whole woman. We just don't look at why you're having it's just painful sex. We look at the whole thing. You may be coming in with a diagnosis of the vulva region or the vagina area. You may become with some type, and I don't want to use all the big words because you may not have been officially diagnosed with it. But now that you know that what you're having, you can then say, okay, I need help. I need to be assessed by some medical provider. And now I need to have pelvic therapy. Pelvic therapy will help usher you there. You may say, hey, my pelvic floor is just so tight. I need to teach myself how to work it out. Well, we can teach you how to do it yourself, or sometimes there's devices that we use that you can work in the comfort of your home to help relax that pelvic floor to be receptive when it's time for sex. So again, as well, stressful situations will make that pelvic floor a lot tighter so that you don't want to receive. So again, it could be musculature, it could be diagnosis, but if it's any of those type of things, pelvic therapy will be a tool that is utilized to allow you to live your best life below the skirt. So hopefully this was informative to you when you speak, and thank you for tuning in, those that are tuning in. Hopefully this is a tool, this information you can be able to utilize this to be able to go on to the next step to live your best life below the skirt. And I'm definitely going to drop in our information below for you to have. So if you want to definitely schedule a consult, you want to schedule a consult, I do free 15-minute consults in the office here. We're located in the Charleston area. We can do a consult if you want to talk about it, to say, okay, is this for me? Is this not for me? If it is for me, what steps do I need to take to be able to come in? So again, our information here, you can check out I kind of put in some wrong information. Ooh. But I'll put in the information here for you to have, and you'll be able to reach out to us to schedule a free consult for yourself, so you can determine if this is the route that you want to go. So to sum all of this up, should sex be painful? Absolutely not. If you're fearful of having sex because you think it's going to be painful, if it's painful if you insert a tampon, if it's painful when you go and have your yearly assessment with your OBGYN, if it's painful when you're having a bowel movement, just any type of pain in that area it should not be. There is help. Don't wait. Don't continue to live in silence. and live your best life below the skirt. You can take that road from painful sex and hop in that car and ride that road to pleasurable sex. You can get there. And it does not allow you this, and don't allow this to stop your future relationships. Don't allow this to make you feel you're not the full woman that you really are. You just need help getting there. Again, you just need help getting there. So it's been good. I have enjoyed doing these lives with you on Tuesday with Below the Skirt with Tamara. And again, the information's there for you if you want to set up a consult. So I hope you have a good rest of the day.